Good day and welcome to Newer TV. This is Dr. Zoma Mubani coming to you with our FICAP scrolls, and I'm coming to you here from our beautiful, fantastic Boo-Boo's room, exam room at Newer World FICAP's Tri-Head area. Today I'll be discussing with you incontinence. Incontinence is also another topic that is dear to my heart. As a urogynecologist, it's my bread and butter, and here we deal with incontinence in women, and it is something that is quite important in the lives of women and beguiles women much more often than men. Incontinence and incontinence treatment and incontinence products cost the United States more than 7 million every year, so it's actually quite an important part of the health treatment in the woman. And so I'm going to be discussing with you about the different kinds of incontinence, and I'm going to, in future series lecture, narrow it down to the most common ones and how we treat it. So in the female patient usually experiences her first sign of incontinence with her first pregnancy. That's when she will experience stress incontinence for the first time. And most of these will resolve after the child is born and the pelvic pressure is relieved after that increased abdominal pressure from the enlarged uterus is out of the way. But then following menopause and the exit of estrogen and the pelvic relaxation again of the genitourinary syndrome of menopause, women can start experiencing incontinence. What is incontinence? Incontinence is the involuntary loss of urine, period. In the young boy and girl, it might be referred to as bedwetting, which is when their systems are not quite developed and they mentally are not able to be attuned to their body to wake up to void, and they can wet the bed. Most children usually outgrow it before their early teenage years, if ever. And most people in their young adult ages do not experience much bothersome incontinence to warrant any doctor's visit or treatment. But as we grow older, and more so in the female, this can come to plague us. And this loss of urine can either occur with urgency and overactivity of the bladder, can also occur with increase in intra-abdominal pressure called valsalva, which we refer to as stress incontinence, where we leak urine on coughing, sneezing, carrying something heavy, and when it gets worse, bending over, even just as turning around in bed or going on a trampoline, and the urine would come out. And when it gets worse, we can actually empty our entire bladder volume when the urine comes out. We also have what we call overflow incontinence, where as a result of incomplete emptying and or partial urinary retention, the bladder just overflows because it needs to release that urine, so that urine will keep coming into the bladder with a negative pressure. And additionally, we can have a combination of all this in a mixed bladder dysfunction, where somebody can experience both the urgency of overactive bladder and or urge incontinence together with stress incontinence, and we refer to that as a mixed urinary incontinence. There would also be incontinence related to use of some medications that might temporarily cause incontinence of the urinary bladder, and there is also the incontinence related to nerve damage in some disease conditions like in Parkinson's disease and diabetes mellitus, and or even spinal injury patients. But the commonest incontinences in the women that occur post-menopause after estrogen has gone bye-bye is urgency incontinence, stress incontinence, or a combination of both. If there is a problem with the effluent of urine and there is some partial blockage or an atonic bladder where the bladder is not able to completely empty themselves, we could also experience incontinence as an overflow because there's just a full bladder and the bladder needs to relieve that urine, and the body chooses to do it the way that makes us uncomfortable but saves the kidneys, essentially. So should you be experiencing significant urinary leakage, do not resolve to using all the urinary protection things that they have out there that we know about, because almost every type of incontinence can be treated, controlled, or even cured. And we deserve as women to have a better take on life and to have a better confidence and not just be thrown away to be wearing pads and diapers as we grow older. So should you find yourself going from panty liners to pads, it's time to head on to Newer World so we can take care of you and get you your life back. Stay tuned for my next series as we delve more deeper into these types of incontinence and what we do for them. Thank you for listening, and bye-bye once again from Newer World.